It is not a marker of the lack of self-discipline. Obesity is a chronic medical condition that truly is multifactorial. It is dependent on so many things like age and sex. What are different cultural norms? What's someone's metabolism like? What genetic predisposition do they have for obesity? It's not just this simple thing like calories in and calories out. Yes, that is the math part of it. Yes, that is the prescription for how we gain weight and how we lose weight. But it is not the sole factor when we're talking about obesity. There's so many other things that go into it. And what works for one person to keep them healthy is not necessarily going to work for another person who has obesity. So I think it's really important that we first talk about that and stop shaming obesity as someone who's just of poor self-discipline or has some kind of underlying personality flaw or weakness. It is so much more than that. Welcome to No Filter Doctor, where we cut through the health hype, dig into what's real, what's backed by evidence, and what works. I'm your host, Dr. AK. Let's get into it. Hey everyone, welcome back. Thank you so much for joining me again this week. This week, we're going to talk about GLP-1 medications, but this isn't going to be a basic overview. We already did that. So if you kind of want an overview about what they are, what they do, you can go listen to the podcast that we did on that already. Today, I want to get into a little bit more details about the nuance of GLP-1 medications. And the main reason for that is I'm hearing this narrative. One side is like, they are amazing. You don't have to do anything. All you need to do is take this medication and they're a miracle. The other narrative is something more like they're evil, they're terrible. People who are on them are just lazy and lack willpower. And that is just not true. Neither one of these is true. The truth is a lot more complicated than that. And that's what I want to talk about today, because I think everyone deserves to know the nuance behind these medications. GLP-1 medications truly have revolutionized obesity care. Obesity became an issue in the United States in about the 1970s, so it's been around for a while. It's not something new that's happening right now. And there have been all kinds of different medications that have come on the market, things like phentermine and other things that have a lot of adverse effects. I mean, there was a class action lawsuit for phentermine. GLP-1s are actually pretty darn safe, and their side effect profile is very well known. And so these medications are recommended in the treatment of obesity, and that's great. But they are neither a miracle nor something evil. They are a tool. Before we get into GLP-1s, I think it's really important to first discuss obesity. Obesity meets every definition for chronic illness. I have a list here I'm going to read. So it needs to be prolonged, recurrent, not resolve spontaneously, require treatment, be multifactorial, produce impairment, progress, and recur. Obesity does all of those things, and there are multiple societies that have made recommendations of listing obesity as a chronic illness. Yet, some people insist that it is not a chronic illness. I promise you, obesity is not just poor willpower. It is not a marker of the lack of self-discipline. Obesity is a chronic medical condition that truly is multifactorial. It is dependent on so many things like age and sex. What are different cultural norms? What's someone's metabolism like? What genetic predisposition do they have for obesity? It's not just this simple thing like calories in and calories out. Yes, that is the math part of it. Yes, that is the prescription for how we gain weight and how we lose weight, but it is not the sole factor when we're talking about obesity. There's so many other things that go into it, and what works for one person to keep them healthy is not necessarily going to work for another person who has obesity. So I think it's really important that we first talk about that and stop shaming obesity as someone who's just of poor self-discipline or has some kind of underlying personality flaw or weakness. It is so much more than that. And GLP-1s have been an exceedingly effective tool in treating this condition. Wegovy got its approval through these STEP trials. Now, STEP stands for Semaglutide Treatment Effect in People with Obesity. This was a multi-part study that was done on various aspects of Wegovy treatment, and it's data from this study that was ultimately given to the FDA for Wegovy to get approval. It demonstrated unquestionable effectiveness in weight loss in patients with obesity, with or without diabetes. It showed that discontinuation can result in weight gain and demonstrated maintained weight loss with continued use. Step 3 specifically showed a greater amount of weight loss whenever the medication was combined with lifestyle modifications. The SURMOUNT trial showed the same exact thing, but with tirzepatide. And the 3-year extension of SURMOUNT-1 demonstrated reduced progression to type 2 diabetes by 93%. GLP-1 medications opened a door to weight loss for so many people who would not have experienced it otherwise. But these medications alone are not enough. The medications should be used along with teaching people how to eat healthy again. A lot of people grew up in situations where they could not afford highly nutritious, low-energy foods. They grew up eating certain foods their entire lives. And a lot of that has to do with how the food supply chain is in the United States, which we won't get into. I highly recommend you follow Dr. Jessica Nurek. She is a dietitian with her PhD, and she has gone into the details of that. So you can go to her for this whole food industry and food supply issue in the United States. But you have to consider that when we're talking about obesity. So some people don't know how to eat healthy. So part of being on these GLP-1s is teaching that. Another important part of this is preserving muscle mass. That's something that happens with weight loss. We also want to improve cardiovascular fitness. For some people, being on a GLP-1 has alleviated their back pain or their knee pain, and now they can partake in physical activity, but they don't know how to because they haven't done it for most of their life. All of that requires a comprehensive treatment plan, and that's the thing that I really want to stress. Being on a GLP-1 requires this plan and requires continued follow-up. So the people who are touting it as this miracle drug and all you have to do is take the medication and not worry about anything else, that is a false narrative. That is not true. In fact, I would argue that GLP-1s aren't even a medication that are great for everyone. 2 patients can have the same exact body composition and require completely different plans, and there's no way to know that unless you actually get to know the individual. One person may have struggled with weight gain their entire life. Another person may have gained weight in menopause, or perhaps it was after some kind of illness. One person may have undiagnosed sleep apnea, and they're so exhausted that they can't even exercise. That's one of the issues why they're struggling with their weight. Another person might be on medications that actually promote weight gain. Antidepressants, insulin, corticosteroids, those all promote weight gain. Some people may have spent years trying to lose weight and they never once got any kind of nutrition counseling or any kind of counseling on aerobic exercise or resistance training. Family medical histories are really important. People with certain medical conditions can't even be on GLP-1s. They're contraindicated, while other people may have concurrent medical problems that can be treated with GLP-1s. Things like metabolic dysfunction, associated fatty liver disease, type 2 diabetes, sleep apnea, chronic kidney disease, cardiovascular problems. GLP-1s have demonstrated improvement in all of those. And sometimes that's independent of the weight loss. You need to know everything that's going on to first determine whether someone's even a candidate for the GLP-1 medications. And then you need to know their whole history, like what is their journey, because they might require a whole bunch of other counseling in order for them to make these new lifestyle changes. It is not easy to go from living a certain way your entire life and then having to learn how to do everything in a different way for the rest of your life. I can't stress enough that it is not about getting skinny. It is about getting healthy. Society has these certain expectations on what our bodies should look like, and so many of those expectations have to do with thinness. It doesn't have to do with a healthy body. And so being on a GLP-1 to get, quote, skinny is not the objective here. It is going on this medication to become healthier. Now, the people on the other side of the coin who want to make it sound like GLP-1s are poison often refer to the fact that a lot of people who go on these medications have muscle mass loss. And they are right. But that is not unique to a GLP-1 medication. That occurs with any kind of large amounts of weight loss. If you go back to before GLP-1s were around, people got bariatric surgery and different kinds of procedures to help with weight loss. They lost weight very quickly, a large amount of weight, and they also lost a tremendous amount of muscle mass. So it's not like these medications themselves go attacking people's muscles and break things down. That's not what happens. One of the things that these medications do is they induce a caloric deficit. For anyone who's been on them, talk to them, they will tell you their food noise is gone and their appetites are reduced tremendously. When food intake decreases, the body then taps into its energy stores for energy. So that's going to be stored fat and it's going to be stored carbohydrate. But the issue is the body also needs a steady supply of protein in order to make the different proteins and enzymes that it needs to function. And the only place that we have stored protein is in our muscles. So what often happens is people go on these medications, their caloric intake drops significantly, which means their protein intake has dropped significantly. And then the body goes to the muscle in order to get the amino acids that it needs to make all of the other proteins and enzymes that the body needs to function. And we absolutely don't want that because of sarcopenia. We've talked about that. Maintaining muscle mass as we age is exceedingly important because the lower amount of muscle mass that we have, the higher our risk for falling or being frail. So we don't want that. We want to preserve muscle mass. So one of the things that has to be done is increased protein intake. Now, there are all kinds of different data points that are out there, anywhere from 0.8 grams per kilo per day. That's what the recommended daily allowance says, but I'm going to tell you right now that is not enough. If someone is on a GLP, they need to be at least 1.6 grams per kilo of protein per day. And it's not of their current weight. You can use some body mass indexes such as fat-free mass. You can also use ideal body weight, but you need to use something in order to calculate the amount of proteins that someone needs. So that is essential. That total caloric intake can go down, but that protein intake has to go up in order to offset that loss of dietary protein that people had before they went on the medications. It's not a one-size-fits-all number. It requires a little bit of mathing. The other thing that you have to keep in mind is the fact that you have to eat protein in order to put on muscle mass. There is a certain leucine threshold that people need to achieve in order to stimulate their muscle protein synthesis pathway. The other thing that stimulates that same pathway is resistance training. The S-Lite trial was done where it looked at liraglutide. And what they did was they took one arm where they just were on the medication and the other arm participated in resistance training. Those people who participated in the medication and resistance training had about 12% muscle mass loss, as opposed to the group who didn't do any resistance training, who had 26% muscle mass loss. And the expectation is not for people to become bodybuilders. Like, I think it's Planet Fitness that's like, I pick things up and put them down. That's not what we're going for here. It's 60 to 90 minutes of resistance training per week. That is literally it. You can use weights, you can use bands. 12 minutes of training a day with resistance bands will meet that 60 to 90 minutes per week. And then the other part of preserving muscle mass is keeping track of how much mass people are losing in the first place. So I've talked about this before. I think I'm going to do a formal podcast on it, but BMI is not where it's at, my friends. We really need to know what the body composition is. So if you get a body composition, whether that be through CT, MRI, DEXA scan, bioimpedance, shoot, that scale that you have at home, it's not accurate, but for trending, it's worth using. We need a baseline of where we started. Because if we use that baseline, and then let's say every 6 to 8 weeks, we do a repeat scan, we can see what is the muscle mass loss. If the slope of muscle mass loss is a little too steep, we don't want that, and we can change that again through modifications. Another thing that people often want to know is, okay, well, if I go on this GLP-1 medication, how long am I going to be on it? And the answer is, it depends. And the part that's really annoying is there's really no biomarker or anything like that out there that we can get in order to predict who's going to be on it for a long time and who might just need a little temporary boost. As I mentioned, several studies have demonstrated that when people discontinue the medications, they will gain the weight back. And I don't think we should be surprised about this in certain individuals. If someone has struggled with obesity their entire life, it kind of makes sense that if you take the medication away that we're using to treat their chronic medical condition, it will come back. That would happen with high blood pressure. That would happen with type 1 diabetes. The disease state doesn't go away just because you were on the medication for a brief period of time. Other people don't necessarily need to be on it for life. So what I've noticed, and this is all anecdotal, is that people who typically have a higher BMI, who have a higher amount of metabolic dysfunction, and who have struggled with obesity their entire lives, they usually need to stay on the medication. The other thing that I've noticed is if patients have already optimized every aspect of lifestyle changes that they could have, and they are still struggling with weight loss, they also generally need to be on the medications for life or a longer period of time. The individuals who usually are able to go on them and come off of them had some kind of event, whether it was pregnancy or they had an illness. These individuals are typically really good at maintaining whatever their weight is, but then they had an event where they weren't able to do the things that they normally do, and then they gained the weight. The problem is they can go back to their regular routine of whatever it was they were doing before, but that weight won't come off. So those are the people who can go on the GLP-1 medications for a brief period of time and get their weight back down to that level that they feel comfortable with. I don't have a paper to tap into to tell you that's the case. I don't know that there is a paper out there that says that, but that is what I've seen in my office with different patients that I have on the medications. But again, that's a conversation that needs to be had in the very beginning before we even go down this GLP-1 pathway. That's something we need to talk about to align expectations, because for some people, being on them for life might actually be an option, and they need to know that going into it. Okay, so now we were on the medication. We got to our target body composition that we want to be at. What's next? This is a little bit of uncharted territory at the moment, and there are some studies that are looking into what do we do when this happens. There is some data that's coming out that's saying, well, what about dose reduction? You used whatever dose you needed to get to your goal body composition, but now that you're there, let's try some dose reduction. I found a case study with 30 participants. Nothing that I would, hang my hat on and revolutionize my practice, but it's worth mentioning that in this study, they kept the same dose, but they went to every other week application, and the individuals who were in that study were able to maintain the weight loss with that schedule. For now, the American Diabetes Association says go to either the lowest dose you need, you can do intermittent dosing, or you can discontinue it altogether and then monitor for any kind of weight gain. Cost is also something that needs to be discussed before anybody decides they want to go on a GLP-1. I can tell you, in my experience, it is completely unpredictable what an insurance company is going to do. I've had some people who literally qualify for bariatric surgery according to their blood work and BMI and all of these other things that are going on, and the insurance company outright would not approve any GLP-1 medications. Some companies will approve semaglutide, but not tirzepatide. Some companies want there to be other medical problems as well, such as hypertension, hyperlipidemia, sleep apnea. I swear I cannot predict what an insurance company is going to want. It is all over the map. And so I think it's really important that people look at their insurance when they are going into this decision of being on this medication, because it may be really expensive. And there are a couple programs that are out there that help offset the cost, but it's still not cheap. It's not like it's a $10 copay. So Lilly Direct has a program where physicians send prescriptions to them, and then a patient pays them directly. So we're cutting out pharmacies and some of these middlemen. It's still not like a bargain. It's about $299 a month for the lowest dose, but that is way cheaper than, say, $700 that some of these pharmacies, these commercial pharmacies that are out there, are charging. So that's an option. Novo Nordisk does the same thing with their medications. There's also other coupon companies such as GoodRx. Mark Cuban started a separate company where he offers the discounted prescription drugs as well. And recently, Medicare has said it will pay for some of these medications. So there are some changes that are out there. But again, cost is a factor, and that is a discussion that must be had prior to these medications being started. Now, obviously, for this next part, I am completely biased, 100%, and I admit that I am biased, but I do have a chip on my shoulder about those online companies that people can just like call up or send a picture of themselves and they're getting these GLP-1 medications, and that is all they're getting. There is no nutrition counseling. There is no monitoring of muscle mass loss. There is no resistance training coaching or anything that's happening with those online companies. I am not against people having access to care as long as it is good care. I'm not convinced that a lot of these companies are providing good care. They're charging typically some kind of monthly fee or membership fee, and then they sell these discounted medications. The reason those medications are discounted is because they are from compounded pharmacies. They are a fraction of the cost of the FDA-regulated medications that are being sold. And there's reasons for that. The FDA has issued multiple warnings about incorrect formulations, contaminated products, or these things that are called semaglutide salts, which aren't even a semaglutide to begin with. What a lot of the compounding pharmacies were doing is they would add like B12 or some other vitamin to whatever the preparation is that they're making, and they'd say, oh, this is a new drug. This isn't what you are saying, so we can still compound. Well, in April of 2026, the FDA was like, no, that is actually not a new drug. You can't take two separate medications and push them together and say this is a new medication. So in my opinion, obtaining these medications from any source other than the companies that receive the FDA approval to make them is a risk. I know the price is very tempting, but it is a risk, and I don't know that everyone's aware of that. The other thing is, online companies rarely manage side effects. Now, I know not all doctors do this, but I feel responsible for the people who I start on GLP-1. So if they have a known adverse effect like nausea or vomiting, or they get dehydrated, they just come to my office and I give them IV fluids. Online companies don't do that. So it is for all of these reasons that I have a chip on my shoulder and an admitted bias. Again, I know I have bias here, and I'm going to be honest with all of you and share with you whenever that exists. But I don't like these companies for GLP-1 medications. I think they're fine for other medications as long as it's not compounded. I'm not into the whole compounding pharmacy thing. But if somebody needs access to care and they want to do some kind of telemedicine thing, and the person on the other end of that call is willing to take responsibility for their entire care and is willing to prescribe medications that are being monitored and have undergone FDA approval, I'm down. Any company that doesn't do that, I question a lot. In terms of mistakes that I see when people go on GLPs, there's a couple of them. The first one we talked about already, and that's protein intake. If you are going to go on a GLP-1 medication, you better bump up that protein. The other thing you need to do is resistance training. Some people won't do any resistance training at all. They'll just go do aerobic activity or some kind of cardiovascular workout, which is great. That's excellent for your heart. It's not going to do anything to preserve muscle mass. Another mistake I see is thinking that taking this medication is going to replace healthy habits. That is just not the reality of what these medications do. People also tend to focus on the scale. They'll go on these meds and then they'll stand on a scale and they'll be like, I'm not losing weight. Not even noticing the fact that an old pair of pants that never fit now fit again. It is so much more important than what a number on a scale says. Body composition, 100%. Someone who weighs 175 pounds who has a body fat percentage of 19% is an entirely different beast than somebody who weighs the same exact amount and has a body fat percentage of 40%. So it's not the scale. It's the body composition. And then last but not least is looking at someone else who is on a GLP1 medication journey and comparing that person's results with their own. You can't look and see what someone else is doing. We've talked about this. Obesity is complex. It's multifactorial. Whatever that person experienced in their life or whatever they have going on in their body that got them to their journey is different from someone else. So you can't really look at somebody and be like, well, so-and-so is on the medications and they're experiencing this. Why am I not? I just can't stress enough that these medications are a tool. They are neither a miracle nor evil. They are a medication that is helping so many people get healthy, not skinny. And I think if we approach these medications from that mindset, from the mindset of, okay, let's start these meds. It's going to help a lot with the cravings, the food noise. It's going to reduce the overall caloric intake, which is then going to create space for learning about healthy eating, learning about resistance training, learning about how to move the body, learning about body composition and ways of getting healthy. It opens a door and it's a tool. It's not about getting skinny fast. It's about being healthy for life. And with that, I will leave you. I would love to hear your thoughts. So if you wouldn't mind commenting, if you want to go on YouTube and see this on video, you can do that as well. And if you like the podcast, I would love it if you could give me a review because I apparently don't have a whole lot of them. And these 5-star reviews are a big deal in the podcasting world. That is it. Have a great week, everyone. I'll talk to you next week. Thank you so much for joining me on this week's No Filter Doctor. If you enjoyed the content, you can follow me on social media. I'm on Instagram, Facebook, and YouTube. You can also go to www.thewholehumanhealthandwellbeing.com and sign up for the weekly newsletter where you will get a link to the blog, that week's podcast, and a health tip of the week sent directly to you. It's important to know that while I am a doctor, I'm not your doctor. This podcast is for educational and informational purposes only, and it's not intended as medical advice. Listening to this podcast does not establish a doctor-patient relationship. The information discussed should not be used to diagnose, treat, or prevent any medical condition, nor should it replace individualized medical care. If you have questions or concerns about your health, please contact your own healthcare provider. Any decisions to delay or forego a medical evaluation or treatment based on the information discussed in this podcast are made so at your own risk. My only financial disclosure is my medical practice, The Whole Human Health and Wellbeing. Take care, and I'll talk to you next week.